First of all, it must be a candidate that meets the criteria for implantation. What do I mean by this? Children who are born who cannot hear are good candidates. Before 3 years are very good candidates for cochlear implants. An adult that lost his hearing after he has learned how to speak also makes a very good candidate. So once you are eligible for the operation, in other words, you meet that criteria, there are things that we now do, tests that we do to prepare you for the surgery. There are many challenges with this. One is that the perception in the community. You've heard of how people call patients, people who have got difficulty in hearing or can't speak, kasiru, okay? So they use such terms to describe these people, and oftentimes are neglected. So problem number one is that patients do not seek help because maybe they are not aware of where to get help from for these problems that they have. Secondly, the number of people who offer services for ear-related problems are few in the country. Okay? We, the ENT surgeons, are few, the audiologists are few, the ENT clinic officers are few. After the cochlear implant, every patient must undergo a rehabilitation. The purpose for the rehabilitation is to train the person who has had the surgery to be able to relate sounds to the actions and therefore develop speech and language. The duration of rehabilitation may take about a year, sometimes even a little more than a year. So the important thing is when you have a patient who has hearing difficulties, let us assess. We find what the problem is and then we find a solution for the problem.